The V-Life with Dr. Annie is produced by Advanced Cardiovascular Care Center with educational grants from Amazing Lines, Dolce Vita Cardio Advanced Med Spa, and sponsored by In Mode Aesthetic Solutions.
Hi, welcome to Live the V-Life with Dr. Annie. Today I'm here with Juliana Hurgoiu, my good friend and RN in our practice. Welcome, Juliana.
Thank you, and welcome back to our show. Today I'm here, of course, with the doctor that I worked with for so long, and we want to discuss about coronary artery disease.
Yes, let's talk about it, because last time we left you with coronary artery disease as far as we talked about prevalence, right? So we want to talk about now symptoms. What happens with coronary artery disease when a patient is maybe just walking down the road or doing their job? Sometimes they may have some chest pain or tightness or heaviness in their chest. Sometimes it's back pain, right?
And sometimes they may have this shortness of breath, and they think that just because they exert themselves for a couple of blocks, they should be okay with having shortness of breath, but that could be an underlying cause.
How about women? Sometimes women are just feeling like they can't do the things that they used to do, because we take so much on ourselves, right? As women, we're taking care of everybody, and then we forget that when maybe we're having some chest discomfort. Right?
So everybody should pay attention for anything unusual, but even that, if you don't have nothing unusual happen to you, it's good to be checked by a cardiologist.
So what kind of tests? Stress test, nuclear stress test, stress echo, ultrasound of the heart, right? So many things that we can do to check them out to make sure, did they have any blockage or did they have any damage to their heart?
Yes, all this testing, it can be done in-house. You don't have to go to a hospital, so you can wait for a long time. We are already here, and you can have the cardiac ultrasounds like Dr. Annie mentioned earlier, and you can have a nuclear stress test, which is done in a very nice and comfortable location, like in our location. And it's going to be very good for you guys to come and definitely be checked.
That's right. So the nuclear stress test may show an abnormality of blood flow. It's very easy for us to find that, right? And the ultrasound of the heart can show us if the heart is moving abnormally. Maybe somebody had a heart attack that was silent, right? We see that a lot. And then if that's abnormal, then we take the patient to the cardiac catheterization laboratory. Easily we can find out if there's a blockage, and we can put a stent, right? Which is now so easy for us to do. Stenting has been around for many, many, many years, and is very safe and effective, right? So beyond that, to stop all that progression of disease, we have a fabulous way of stopping progression of disease, right? Actually reversing coronary artery disease, and that's fabulous. So we want to make sure that you know what's going on with coronary artery disease, how you can protect yourself and your family. If you have any questions, we want to take those questions. Email us at that email that you see at the bottom of the screen, and join us next time for Live the V-Life with Dr. Annie.
The V-Life with Dr. Annie is produced by Advanced Cardiovascular Care Center with educational grants from Amazing Lines, Dolce Vita Cardio Advanced Med Spa, and sponsored by In Mode Aesthetic Solutions.